100 free NCLEX practice questions and answers updated for 2026. Question 1. A patient is about to undergo a bone marrow aspiration and expresses fear and anxiety. Which of the following is the most effective nursing response? Option A. Warn the patient to stay very still because movement increases pain. Option B. Encourage the family to stay in the room for the procedure. Option C. Stay with the patient and focus on slow deep breathing for relaxation. Option D. Delay the procedure to allow the patient to deal with her feelings. The correct answer is option C. Stay with the patient and focus on slow deep breathing for relaxation. Guided deep breathing effectively lowers the heart rate, mitigates the panic response, and builds a trusting therapeutic relationship during a painful procedure. Question 2. A patient with Hodgkin's disease underwent a lymph node biopsy. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Option A. Reed-Sternberg cells. Option B. Lymphoblastic cells. Option C. Gaucher's cells. Option D. Reeder's cells. The correct answer is option A. Reed-Sternberg cells. The absolute definitive diagnostic hallmark of Hodgkin's lymphoma is the microscopic presence of giant, abnormal, binucleated lymphocytes known as Reed-Sternberg cells. Question 3. A patient is admitted to the oncology unit for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Option A. Painful cervical lymph nodes. Option B. Night sweats and fatigue. Option C. Nausea and vomiting. Option D. Weight gain. The correct answer is option B. Night sweats and fatigue. The classic B symptoms of systemic lymphomas include profound fatigue, unexplained weight loss, fever, and drenching night sweats. Question 4. A nurse is caring for a patient with acute lymphoblastic leukemia. Which of the following is the most likely age range of the patient? Option A. 3 to 10 years. Option B. 25 to 35 years. Option C. 45 to 55 years. Option D. Over 60 years. The correct answer is option A. 3 to 10 years. Acute lymphoblastic leukemia is the most common childhood cancer, peaking significantly in incidence between the ages of 2 and 5 years old. Question 5. A patient is undergoing treatment for leukemia. The nurse teaches the family about infectious precautions. Which statement indicates the family needs more education? Option A. We will bring in books and magazines for entertainment. Option B. We will bring in personal care items for comfort. Option C. We will bring in fresh flowers to brighten the room. Option D. We will bring in family pictures and get well cards. The correct answer is option C. We will bring in fresh flowers to brighten the room. Leukemia treatment severely suppresses the immune system. Fresh flowers and stagnant water harbor lethal fungi and bacteria, making them strictly forbidden in neutropenic rooms. Question 6. A client who has facial drooping, a weak cough, and decreased gag reflex is admitted for treatment. Which of the following actions should the nurse implement first? Option A. Complete the Glasgow Coma Scale. Option B. Provide a communication board. Option C. Consult a speech-language pathologist. Option D. Auscultate lung sounds. The correct answer is option D. Auscultate lung sounds. A weak cough and absent gag reflex put the patient at extreme risk for aspiration. Auscultating the lungs immediately identifies if fluid or food has already entered the airway. Question 7. A nurse cares for a client who is 1 hour post-vaginal delivery. Which of the following findings is an early sign of postpartum hemorrhage? Option A. Shallow rapid respirations. Option B. Petechiae. Option C. Increasing heart rate. Option D. Lethargy. The correct answer is option C. Increasing heart rate. As the body rapidly loses blood volume, the heart immediately compensates by beating faster, tachycardia, to try and maintain cardiac output and blood pressure. Question 8. A nurse administers 8 units of regular insulin to a client at 0730. What time is this client most at risk for hypoglycemia? Option A 0700. Option B 0800. Option C 1000. Option D 1430. The correct answer is option C, 1000. Regular insulin is a short-acting insulin that hits its absolute peak action and greatest risk for plunging blood sugar approximately 2 to 3 hours after administration. Question 9. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? Option A. Change the disposable mask immediately. Option B. Change gloves immediately after use. Option C. Minimize patient contact. Option D. Minimize patient conversation. The correct answer is option B. Change gloves immediately after use. Meticulous hand hygiene and immediate glove changing after touching any contaminated surface are the most effective ways to prevent transferring lethal infections to a neutropenic patient. Question 10. A nurse in the emergency department assesses a patient taking long-term corticosteroids. Which of the following is a typical side effect of corticosteroid treatment? Option A. Hypertension. Option B. Cushing's triad. Option C. Hyponatremia. Option D. A low serum albumin. Option E. Weight loss. The correct answers are options A and B and D. Hypertension, Cushing's triad, low serum albumin. Long-term corticosteroid use fundamentally alters metabolism, leading to fluid retention, severe hypertension, fat redistribution, Cushing's appearance, and protein depletion. Question 11. A nurse is caring for a patient with a platelet count of 20,000 per microliter. Which of the following is an important intervention? Option A. Observe for evidence of spontaneous bleeding. Option B. Limit visitors to family only. Option C. Give aspirin in case of headaches. Option D. Impose immune precautions. The correct answer is option A. Observe for evidence of spontaneous bleeding. A platelet count below 20,000 puts the patient at imminent risk for massive, unprovoked spontaneous hemorrhage, requiring intense monitoring. Question 12. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Option A. Weight loss. Option B. Increased clotting time. Option C. Hypertension. Option D. Headaches. Option E. Bradycardia. The correct answers are options B and C and D. Increased clotting time, hypertension, headaches. Polycythemia vera produces massive amounts of red blood cells, turning the blood thick and viscous. This directly causes severe hypertension, headaches, and a risk for clotting. Question 13. A patient who has received chemotherapy for cancer treatment is given an injection of epoetin. Which of the following should reflect the findings in a complete blood count drawn several days later? Option A. An increase in neutrophil count. Option B. An increase in hematocrit. Option C. An increase in platelet count. Option D. An increase in serum iron. The correct answer is option B. An increase in hematocrit. Epoetin alpha is a synthetic version of human erythropoietin, which directly stimulates the bone marrow to produce red blood cells, thus raising the hematocrit. Question 14. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? Option A. Blood pressure 146/88. Option B. Respirations 28 and shallow. Option C. Weight gain of 10 pounds in 6 months. Option D. Pink complexion. The correct answer is option B. Respirations 28 and shallow. Anemia means the blood lacks oxygen carrying capacity. The body compensates for tissue hypoxia by breathing faster, tachypnea, to pull more oxygen into the lungs.